Hello everybody, this is my assignment for Music for Health and Wellbeing 1A, my video assignment. My name's Meredith Hall, and this study that I'm presenting is on the effect of maternal lullaby on neonates. It was a study done relatively recently. It's conducted in the last couple of years and only published in 2020, and it attempts to discern the benefit of an auditory stimulus by way of maternal lullaby upon the stress response of preterm infants. It does this by way of measuring the physiological parameters of the infants during both a lullaby stage and a non-lullaby stage, so two different time periods of study. This study was published in the journal Pediatric Research, which is a reputable peer-reviewed publication. Now, the purpose of this study was to see the effect of lullaby on the maternal voice of the infant. Lullaby sung by the mother, in other words. It's particularly a low-cost intervention to support the physiological state of these vulnerable infants who spend long times in the neonatal intensive care unit, the NICU, which places a stressful burden, particularly in terms of the form of auditory stimulus upon the central nervous system of these neonate infants. The irritating environmental auditory stimulation of the NICU upon the infant is seen to compromise the neonatal development. Preterm infants exposed to the environmental noise of the NICU show increased heart rate, blood pressure, and respiratory rate as physiological markers indicating an increase in stress to the neonate. The purpose of this study is thus to see whether maternal lullaby singing can somewhat ameliorate this stressful environment, particularly as it is a harmless, affordable, and pretty easy to implement, and it can potentially improve neurodevelopmental consequences as well as improving physiological parameters for the newborn. So these babies that were studied were born at an average of 32 weeks gestation, which is basically a couple of months early. This study was done in Tehran, Iran. The sample was selected from a single hospital under the supervision of the Tehran University of Medical Science. The subjects were 40 hospitalised infants, and the study criteria was that firstly they had to have a gestational age of 28 to 34 weeks at birth, no congenital abnormalities, not having undergone surgery, AGPAS scores, which is a score of responsiveness of more than 6 at the 5-minute mark after birth. There had to be accuracy of infant hearing health, which with a confirmed auditory test, and there was no use of mechanical ventilation of the infant. So the study subjects were recruited with a parent's permission. There was a consent form signed, entering the group during the 3rd day after hospitalisation. The study was approved by the ethics group of the university. So the maternal lullaby. The infant was placed in what was called a differential thermal analyzer incubator, which enabled measurements. The supine position was chosen, which means lying on the back, with the ears free for hearing. There was an oximeter probe attached to the right foot of the infant, with 2 speakers placed at 30 centimetre distance from the neonate in 2 corners of the incubator. Sound was played at 50 decibels, which was sufficient to cover the ambient noise. A Sony MP3 player was attached to the speakers, and the observations were done at least an hour after feeding. The mother was given a fixed text, which she pre-recorded in a different room. The study was done for 4 consecutive days, 2 days with the lullaby and 2 days without the lullaby. Every day the infant was studied for 40 minutes, 10 minutes before the lullaby was played, 20 minutes during the playing of the lullaby, and 10 minutes after. Placement of the infants in one or other of the stages, i.e. the stages of lullaby playing and non-lullaby playing, being the way of randomly controlling, making it randomised control trial, was done with a randomised method. The data of the physiological parameters of the heart rate, respiratory rate and oxygen saturation were collected every 2 minutes. This study was done over a time period of 5 months, and the measurements were analysed with a statistical analysis program known as SP22. The values and frequency were reported, so the values were mean values and the frequency was a percentage. There's a statistical measure called P, which is an indicator of how random or not the results are. And for a statistical study to be valid, they need low p-values, which means there is a very low probability of the results being random. And this was, in fact, the case for this study. Given that there was an interventional group, i.e. one where the lullaby was sung to, and one when there was a control group where it was not, even though these were actually the same babies at different time periods, this trial can be classified as a randomised control trial. So the results. The statistical results showed a significant difference between the oxygen saturation in the infants between the lullaby stage and the non-lullaby stage. That's the first horizontal column. The second horizontal column of respiratory rate showed no statistical difference, although there was a downward trend. The heart rate, there was a statistical difference between the heart rates of the infants between the lullaby and non-lullaby stages. Discussion of the limitations. The designers of the study were careful not to include depressed or substance-addicted mothers in the study, which could have confounded the results. The results indicated the baby's heart rate fell whilst hearing the lullaby, and this fall persisted for a time after the music finished. This was seen to be the result of the parasympathetic effects, leading to pacification, greater ease, regular deeper breathing, and induction of brain alpha waves. The results also showed that the oxygenation of the blood was improved. The researchers hypothesised this was the case because of the increase in deeper breathing, leading to respiratory efficiency and thus a higher level of oxygen saturation. Overall, the conclusion was that the maternal lullaby exerted positive effects. upon the physiological parameters of the preterm neonate. Because neonatal stress and autonomic stability are the most important factors that affect the developmental outcomes for these preterm babies, the conclusion is that lullaby is one of the most cost-effective supplemental cares that can be used in the NICU. The limitations. This study was based only over 4 days, studying only 40 minutes per day, which seems a very short time. It will be therefore very interesting and relevant to see what more repeated exposures over longer periods of time resulted in. Given that these neonates can spend up to many months in hospital, 4 days, of which only 2 the lullaby is played, seems a very small sample in the overall arc of development. Another limitation is that it is difficult to get an effective control group in this situation because no parent wants their infant to be in a group which does not receive the perceived benefit of the lullaby treatment. Hence why this study had to be done with the same children but just days on and off. Also, assumably, parents may sing to their children whilst visiting, which at another time, which could affect the results. It would also be interesting to see whether similar or comparable results could be obtained with non-maternal singing of lullaby, i.e. by nurses or so on. The recommendations or not. I think that this study provides an interesting template for what could be a much more comprehensive study, i.e. conducted with more exposure time to lullaby over longer periods, for example, daily for a month. It would also be interesting to track the development of the neonates later on in their childhood, i.e. post-hospital, to try to assess the significance of a lullaby intervention. It does provide clear evidence to recommend to parents of these neonates that they sing to them as much as possible, as it does reduce the infant. This seems fairly readily proved. Hope you've enjoyed this presentation.